In your morning medical news, according to a new study, the smoke from climate-fueled wildfires contributed to thousands of U.S. deaths over 15 years between 2006 and 2020. Wildfires driven by climate change caused about 15,000 deaths and $160 billion in health damages. The worst impacts were seen in Oregon and California. Maternal mental health, meanwhile, is often overlooked. Experts say many times these illnesses go untreated and can have a significant impact on mother and child. Mandy Gaither explains why these conditions go unnoticed and has some red flags everyone should know about.
From the time a person becomes pregnant up to a year after giving birth is called the perinatal period. And for about 800,000 Americans, it's a time when mood disorders are born, including conditions like depression, anxiety, and postpartum psychosis.
25% of those people get treated for it.
Andrea Clark with Postpartum Support International says many times inadequate screening is one of the contributing factors that leads to these mental illnesses being overlooked and untreated. That's why she says there needs to be multiple points of screening from the prenatal through postnatal periods.
There is sort of a stigma and even a reluctance sometimes to name things that might be going on with them emotionally or their mental health because of the fear of the way systems may deem them not fit to parent.
While symptoms will vary depending on the mental illness, at a few weeks into the postpartum period, Clark says those symptoms can include trouble getting out of bed, appetite changes, feelings of sadness most of the day, lack of connection or bonding with the baby, and thoughts of harm to yourself and or the baby. She says these are just some of the signs that you or a loved one should seek care.
There's help, there's hope, and you are not to blame. You are not alone.
Perinatal mental health conditions can not only affect the pregnant person, also other families, including the partner. These illnesses are treatable and you don't need a diagnosis to reach out for help. And people lacing up their tennis shoes for a good cause. Saturday was the third annual Lacrosse Area Parkinson's Walk. That event aimed to raise awareness of the disease and spread support for those in our community living with it.
Parkinson's disease doesn't have a cure, but there's a ton of research being done, and it's really important to bring awareness to that and also raise money for exercise programs and support groups here in the area that can support individuals with Parkinson's.
The event also had exercise demonstrations.